My dear friends, greetings from the Community Positive Health Attitude Initiative. My name is Professor Edin Dibuago. I am a professor of public health medicine. And we are working with this Community Positive Health Attitude Initiative to give you positive health talks that will inform you about the things you do, how you live to stay alive, to avoid diseases. Our business is to lead you on disease prevention, watching your health, and staying alive. And our topic today is going to be on hypertension, the silent killer. We are going to take it in 4 segments, 4 episodes. The first one we are going to take now is we are going to give you the basic facts about hypertension. We are going to give you the risk factors of hypertension. Those are the things that can make you develop hypertension. And we're also going to give you the symptoms, what you can watch out for hypertension. Hypertension, high blood pressure is also called high blood pressure. Incidentally, it is this pressure that is exerted on the walls of the big arteries and big blood vessels and arteries when blood is being pumped out from the heart, during circulation. This pressure is usually recorded in 2 parts. The first one is the pressure with which the pumping, when the heart contracts, the pressure it exerts on the wall is known as the systolic blood pressure. That's the upper one. The lower one is the pressure that you record when the heart contracts. Incidentally, things happen at times, and classically the textbook value is 120/80. But again, anything below that, but is not lower than 90/60 is okay. If it goes below 90/60, you're talking about hypotension, which is a medical emergency. So in fact, hypotension, some people who take antihypertensive drugs and they don't watch it, if they take it so much and they become hypotensive unnoticed, that could kill. Incidentally, this hypertension is called a silent killer because most of the time it doesn't come with any symptom. You see young men, not very old people, walking around, suddenly dropping dead, slumping and dying, many of them as a result of hypertension. This problem is more prominent in blacks in sub-Saharan Africa. It's found out that in 2021, up to 1.28 billion human beings suffered from hypertension. And as high as 2/3 of this number were in the sub-Saharan African region. Mind you that the whole global population is not more than 8 billion, between 7 and 8. So you see it's a very big problem. This disease affects males slightly more than females. 1 in every 4 males, is hypertensive, while 1 in every 5 female are hypertensive. Like I said before, for you to say somebody is hypertensive, you have to measure the blood pressure. The WHO recommends in a sitting position 2 consecutive days. If it's consistently higher than 140/90, you say the person is hypertensive. But then recently, when we talk about diagnosis, you see some of these American institutes, they've brought it down, as low as 130/80. But again, let's work with the things we've been doing in the past. So that is it. This problem, the whole idea of talking about this is to make sure that people no longer die of hypertension, because it's been seen that most premature death globally is as a result of hypertension. So that is by way of the basic facts about hypertension. Let's quickly look at the risk factors. Risk factors are those things that has to do with the way we live, our behavior, situations around us that could make us predispose us to having hypertension. And when you come to these risk factors, we usually classify them as the ones you can modify, the ones you can do something about to avoid is modifiable risk factor. The ones you can't do anything about is non-modifiable risk factors. And the whole idea of usually talking about this and letting people know that people work on themselves and make sure that at least the modifiable risk factors that you can do things about, you try to avoid them so that you don't get this disease. So the non-modifiable risk factors, they're basically 4, starting with family history. Anybody who either the parents, the siblings, or close relatives died of hypertension or has hypertension is at risk of having hypertension. So we encourage such people to pay more attention to their health, check, do regular checkups. It's a very easy thing to monitor. Check their blood pressure and see if they are hypertensive, they start early. And this is a disease, if you pick it early and handle it well, you are good. You don't have any problems. So family history is a non-modifiable risk factor. The other non-modifiable risk factor is race. It's been found out that black people are more predisposed to having hypertension and dying from hypertension than the whites. So generally, if you're of the black race, you watch it. It's nobody's fault, but it's there. It's a risk factor that is there that you can't do anything about. The only thing is that you keep watch and make sure it doesn't take you. The third non-modifiable risk factor is age. Definitely hypertension is commoner in older people. So the older you get, the more you should be aware that you must do something to ensure you don't die of hypertension. And it's been found to be a lot commoner from the age of 65. So people who are aged even from 50, make sure you check your blood pressure regularly. It's so easy to check. It's non-invasive, So that is a non-modifiable. We can't do anything about getting old. We all pray to get old, but you just take care, make sure you don't die of hypertension. The last one is sex. Again, my male folk, watch it. It's commoner in males than in females. But that doesn't mean females too shouldn't do things to check themselves. So these are the non-modifiable risk factors. Then we have the risk factors that you can modify, you can work on and make sure you don't, aside from trying to pick it early like you do with the non-modifiable ones, these are things you can actually do to prevent it. We'll talk more on it when we get to the prevention aspect of this talk. These non-modifiable risk factors, the first one is unhealthy diet. Honestly, the things we eat and the way we carry on with food, it says a lot about our health and our longevity. Diet rich in red meats, saturated fats, unwholesome meal like fat, butter, milk, and all that. Excessive intake of these things contribute. And if you don't take enough fruits, meal like fruits, grain, they all help. Legume, beans, and all that, they all help in preventing this kind of disease. So generally, vegetable fruits are so good, and then you take meal that has potassium. Potassium has been found to, be helpful in controlling hypertension. So these are the things you must watch what you eat. Then the other risk factor that is a bit related to the meal too is excessive salt intake. This has been found to be a very big problem. Salt, there's a component of salt that is sodium. Sodium has been found to increase the risk of hypertension. And people who have hypertension and they keep taking so much salt, it hinders their recovery and then even the response to medicine. So you try and don't add salt to your meal after it has been cooked. But find out one of the meals that people add so much salt when cooking it so that you avoid, adding extra. No. The important thing is the quantity of salt you take. The message is don't take too much salt. Is injurious to your health. The next one is food, again, very high in cholesterol. Cholesterol and some of these bad fat, there's this low density lipoprotein that go clogging the inside of your blood vessels. When they do that, they narrow it. You find out, remember we said that blood pressure is the force used in pushing blood through those vessels. When you narrow it, you require more force to push them. And those more force, they will translate into hypertension. So you must go down on your cholesterol intake. And the things that have cholesterol are things like, of course, again, butter, margarine, all those hard fats. If you're taking things like groundnut, peanuts are okay, but don't take them excessively, especially if you notice that your cholesterol level is going high. Then, of course, another risk factor that you generally should avoid is avoid being obese. And remember, if you watch what you eat and you exercise, you go off those things. There's this disease. Another risk factor is diabetes mellitus. is related, very closely related to hypertension. You find most people who have diabetes, they have hypertension. They're related. So if you are diabetic, you know it's a risk factor. And then you do all you can to control it. And you keep checking your blood pressure to make sure that that twin brother of diabetes, which is hypertension, that you're not a victim to it. Because remember, hypertension, silent killer, comes gradually and it could knock you off. You'll be thinking it's still only diabetes, but before you know it, hypertension has taken the fellow. Again, just a little more word about obesity. You remember, and overweight. There's what they call body mass index. You know, that is what you use to check whether you're overweight or obese. Values that are above 25, is but below 30 is overweight. But once you're over 30, my dear brother, is a problem. They usually get this value by, taking your height squared, your weight divided by your height squared, in meters. So anybody can check it and keep an eye on your body mass index. If you're getting so big, increase your exercises, reduce your, eating all those garbages that make you go big. So that is it. The other modifiable risk factor, my dear friend, is excessive alcohol intake. We've said it, even in cancers. In some of our talks, we told you that excessive alcohol intake is a problem. So do all you can to avoid it. We don't say you don't take a little bit of alcohol or normal thing. We all know when we are going beyond what is normal. There's no way you can live your life. Every day you must drink 2 bottles of beer. It's not right. See, at the end of the day, when you get older, you see the results of that kind of life. They might give you so much fun when you're doing it, but if you start getting old, you see. The same thing with the other risk factor is tobacco smoking. Another very dangerous risk factor for cancers too, both diabetes, both hypertension. So these are the things, because we said you can take a little alcohol, but tobacco smoking, honestly, my dear friend, no benefits, no scientific benefit has been associated with tobacco smoking. In fact, aside from making hypertension and diabetes, from up there, you run the risk of even cancer of the throat down there. So tobacco smoking is not good. These are the things you can avoid and you live well and healthy life. So the other risk factor is physical inactivity. It's so important that you move around. Some people, you just sit in your house. You want to drink water, you must call somebody to get water from the fridge. Some of these indoor little things, they help. The sooner we develop the habit of doing them, the better and the longer we shall live. So it's even recommended, aside from those little ones you can do, go out of your way. You don't have to go to anywhere or gym if you can't find, but you can stay in your house and exercise. You exercise at least. The recommended duration is 2.5 hours in a week. That means at least 30 minutes in a day for 5 days. You ought to have 1 or 2 days of the week to rest if you feel like. But if you can do it all through, it's good. But don't start this exercise so strenuously. Don't hurt yourself because you want to do it. If you haven't been building it up, gradually, you might just start and you cause a spike in something and you have a problem. So, but exercise, build it up. You can stay in your house and dance. We'll talk more about some of these things, some of the ways you can do these things and then reduce your tension when we talk about prevention of hypertension. So, then again, stress. Stress is both your emotional and physical discomfort you undergo as a result of everyday challenge. It's difficult. We all know what you've gone through. We all know what everybody is going through. It's so hard. Even the rich, you go through stress. Even trying to think how to manage your money, how to make more money, big stress. But it's only you that can tell yourself the truth and go low on some of those things. You need to stay alive to enjoy what you have. So don't let so much stress of making money, stress of investing, stress of everything. We can understand ones that are stressing to eat, to put, food on the table. But this all that stress for the very rich and affluent, they can go down. That's why some drop and die. And when you do, some other people enjoy all those things you're stressing for. So stress is a no-risk factor for hypertension. My dear friends, please go down on it. So those are about the modifiable risk factors. I've talked about physical activity. So let's talk about symptoms of hypertension. That's the last bit we take on this episode. Symptoms of hypertension. Again, don't wait until you see anything as a symptom. That's really what we need to say to you before you raise alarm. Because by the time symptom is coming, it might be late. The first symptom, you could get is stroke. If you have stroke, that is a complication of hypertension, not symptom. That's one of the basic information really you need to know. Stroke could be and once you have stroke, it's usually bad. Stroke, it could be thrombotic or hemorrhagic. It could be as a result of rupture of a blood vessel in the brain, because without pressure that is pumping out heart, if happens to small arteries in the brain, it could rupture and you bleed into the brain tissue, and that is it. Depending on the area it is, you start losing functions of the areas controlled by that aspect of the brain. If it is thrombotic, which also could be as a result of hypertension, it blocks blood flow to there. And once it happens, and you're not lucky, there's what they call transient ischemic attack, mild stroke that does and recovers. Not everybody is lucky. So once it happens and is extensive, that might be the first symptom you're getting as hypertension, and unfortunate people die. The lucky ones recover. So the story is, don't wait until you start having symptoms. So, but of course, the other mild symptoms you could get, depending on how severe the hypertension is, you could start having early morning headache. You could start having blurred vision. You could start seeing double. It could start affecting your sense of smell. You could start having nosebleed. And nosebleed means tiny vessels inside your nostril has ruptured as a result of that force, and you see blood. You could get dizzy. So many things. Some people can have convulsion. Some can, be confused. Just suddenly you see somebody who you've been discussing with apparently normal, starts talking irrationally. You think the fellow is mad. No, it could be as a result of hypertension. So that's why we advise that you don't wait until you get any symptom before you check yourself. It's so easy. This Figmo, anybody can be taught to monitor. And in fact, these days they have electronic, but make sure you get a reliable one. Things that you just put in and it tells you your blood pressure and your pulse. Let's be alive to this effort to stay alive. So, my dear friends, these are the basic symptoms you could see if you see them, but don't wait for them. And we usually end this each segment of our talk by giving you a message from the Community Positive Health Attitude Initiative team. Our business is to make you stay alive and enjoy your life, stay healthy. So that's why we said that. We found out that, between 1990 and the year 2019, that hypertension, cases of hypertension globally, has doubled. It's alarming. Has doubled. And you find out that 50% of those people who are hypertensive are not aware that they are hypertensive. So don't, and you can only be aware if you check. So don't let yourself be classed into, because those other 50% that are not aware, they run the risk of sudden death. Maybe later I'll tell you, even in North America, you find out the greatest cause of those sudden death and things are hypertension. It happens, is a global problem, but it's more in sub-Saharan Africa. So that's our message. We keep telling you that we love you. And of course, not only us, your very close ones love you too. Once you are alive, there are so many things you can do for money. Why don't you stay alive? Stay alive and check your blood pressure. Hypertension is a silent killer. Don't let it kill you silently. And please, do not say like most people say, it is not my portion. Whose portion is it? If you're careless, it can be your portion. Please go and check your blood pressure and make sure you stay alive. Thank you so very much.